So, hello, hello, hello. Welcome everyone to this awesome session on postpartum recovery. When we talk about new mothers, we also talk about sleepless nights, of so much fatigue, of so much tiredness, lot of confusions, lot of self-doubts. Whether am I doing correct? Is this the correct way of handling a baby? Am I doing it correct? There are a lot of things, and always by doing these things, we always put our health backwards. We might be facing issues with our back, we might be facing issues with our neck pains and all that, but we always overlook them just because we are caring for our babies. And yes, they need that kind of support from you, they need, because they are all dependent on you. But girls, you have to all understand that if you are good, if you feel good, if you are happy about your body, if you feel more energetic, that will be best for your child, because a child wants a happy mom. So first of all, we have to start caring for ourselves. And I see a lot of mothers have so many issues related to postures, related to pains, and a lot of things are there. So I've invited Dr. Akansha Dixit. She will be here with us. She's already here with us. So she will guide you all about the different things related to that. And let me just introduce her. So she's Dr. Akansha Dixit. She's a MPT in physiotherapy, and she's certified women in health physiotherapist. She's certified antenatal and postnatal exercise specialist. She's a consultant physiotherapist, and also she's ex-professor of People's University, Bhopal. So, and recently she has also joined us as lactation expert at Maa-Si Care Clinic. So today she will be joining. So welcome, Akansha. Please open up your video so that we all can see you. Great. So welcome, Dr. Akansha. How are you?
I'm good, Tanima ma'am. Thank you so much. How are you?
How are you? Yes, I'm good too. So we are seeing our participants are here. Some are raising their hands also. So girls, this is not the time to take your questions. First, Dr. Akansha will guide you all. And at the end, we will take question answers. So now all hand over to Dr. Akansha. Now you can take forward.
Okay. Thank you, Dr. Tanima. So am I audible to all of you?
Yeah, great. So we can see a thumbs up. So that means you're audible.
Okay. So let me just try to share my screen. I think there's some setting which needs to be changed, Dr. Tanima.
You're not able to share the screen?
No. It's showing that host may
Okay.
disable participant screen sharing.
Just a minute. Now see, can you hear that? Can you see that?
Yes. Now I'm able. So is this visible to you? All right. Let's just start with my presentation. Postpartum recovery, nurturing a new mom. So all of you here are new mothers, right? Why do we need this postpartum recovery? What is postpartum recovery? First, just let me ask you whether you people are comfortable with English or Hindi or a mixture of both. Please type in the chat box. In which language do you want me to continue? Everyone comfortable with English?
You can write in, you can raise your hands if you're not seeing the chat previews. Like if you're able to write in the chat box, and if you're not able to write in the chat box, you can just raise your hands. Great. So participants are raising the hands. So Dr. Akansha, you will see there, they're raising the hands for that.
Okay. All right. So let me just continue with my presentation in English. Okay. So what is postpartum period? Postpartum period is the first 6 weeks, which is after giving the birth, But it's not limited to first few weeks because the body undergoes so much through a childbirth that it is still in recovery process after few months, after 6 months. Okay. So how do you feel after giving a birth? Is it exciting? Is it confusing? Is it like so much of mental workload that you have after having a birth that you have to take care of that baby and then you just keep forgetting about yourself? There are so many sleepless nights and then the baby, yes, when you look at your baby, you feel that warmth, you feel that love. But taking care of a small baby is very, very tiring. All of us have undergone that phase, and all of you would agree to me that yes, motherhood initially it is tiring for a mother. Okay, so from conception to birth, your body it goes through a lot of changes, and that is why the it is also called as नया जन्म हुआ है माँ का, right? So your this is a new life for you as well as your baby. What happens exactly after this? Think something got wrong. What exactly happens after this? The key body changes which our body undergoes through pregnancy is all of you know hormonal. I'm just revising it for you. Hormonal changes, the uterine changes. What is uterus? Where the baby resides in our body. Cardiovascular changes. There's so much of workload on heart to keep pumping it for to meet the requirements of mother as well as child. The weight gain, which is the most important thing for us to again then come back to the previous body, the pre-pregnancy load. Then musculoskeletal changes. There are a lot of pains here and there. The digestive system changes, which happens in first trimester as well as last trimester. There's nausea, there's constipation, few people get diarrhea, and then there's loss of appetite, and then there's lot of appetite. So everything is just haphazard. Then the respiratory changes. I think many of you might have observed that while you were pregnant in the last few months, you might have got this breathlessness after on exertion, or even after climbing 2, 3 stairs, you might have been felt that no, I'm just getting breathless after even a few stairs. Then genital and breast changes. There is so much breast engorgement in last few months of pregnancy and then after delivery, obviously for the baby's growth. And then you also feel some heaviness in the genitals because of the weight of uterus. The all of the pelvic floor it just grows or it just stretched out to accommodate the weight of the baby. So all these changes a body is going through. So what happens exactly after childbirth? Now the body tries to recover back to pre-pregnancy stage. So we have all the transformations which we get after childbirth, and there are a few milestones which we achieve slowly, gradually, progressively. We achieve all the milestones. Then what are these milestones? These are again whatever change our body has gone through, it has to go back to pre-pregnancy stage. So what happens here is again uterus, it goes up till here into the chest cavity, and then again it has to move back down to the pelvic cavity to its original size. Then the vaginal bleeding occurs, which all of you know that yes, the bleeding it does not only compose of fresh blood, but it is also composed of mucus cells, and sometimes it's thick drops, and sometimes it's fresh blood free flowing. In the perineal discomfort, most of the people who undergo a normal vaginal delivery, they also receive episiotomy, which is called as a cut in the pelvic floor, so that the baby head can move outside easily. So they have this perineal discomfort all the time while sitting or lying or just turning on the bed. And then breast changes, the breast, they get filled with milk and a lot of discomfort because a lot of discomfort to few people. Those people even get breast engorgement. There's thick milk plugs, and which are very painful and inflamed. Then fluid loss and sweating also happens, and changes in abdominal size. Most of the people have zero figure, and then they get this hanging tummy, mummy tummy, which is also called. Then changes in bowel movements. You also get issues while passing your motions. Few people get constipation, few people get diarrhea. Then swelling and water retention. Everyone, they are, I think you have also might have also observed other people also, those who are new mothers, they are usually very puffy. Why? Because they have this much of water retention in their body. Because of that, they look swollen eyes, their hands and wrists are also swollen. And because of that also, they have a lot of stiffness in their body, then increased blood flow. The pelvic flow, it has decreased blood flow, but the other overall blood volume is high, and that's why the swelling is there. Then emotional and mental well-being, postpartum depression. Yes, postpartum blues are very real. I myself have gone through it, and I know there is a reason why these mothers, newborn mothers, are so much in mental load because of all the hormonal changes that they get after childbirth. And usually it's very at peak on third day, because third day is something when when there is a shift in the hormonal level, and also the milk is also coming. So the third day postpartum is particularly very important or very hectic for new mothers, emotionally, emotionally. Then fatigue, it is also again because of obviously the trauma of childbirth. It is, it is, that is why it is called as labor, because your body is undergoing so much of hard labor to bring a baby in this world, right? All of you will agree with this. Now we are coming on to postpartum healing. What is postpartum
Just a
healing?
minute, just a minute, Dr. Akansha. I want to
Yeah.
ask how many of you are feeling that you face these kind of issues which Dr. Akansha is sharing, and you really feel that this is so much required to be discussed on all those things. Just please raise your hand if you are feeling that yes, this kind of issues needs to be discussed. Great. So I can see there are participants who are raising hand, and this is a very common thing which is happening with new mothers, and they really need all these kind of teaching so that they can take very good care of their own health. Very good. Take care. So please, Dr. Akansha, keep moving ahead.
Yeah, thank you. So the recovery period. Now, when we are saying the recovery period, is there any difference between women who have undergone normal vaginal delivery and women who have undergone cesarean section? There are few people who just allege a cesarean section mom that, oh, you have taken the easy route. You have taken the easy route. You have not undergone labor and cesarean. You have tried to avoid normal childbirth pain just to ease it out. But no, that's not the case. Even in cesarean is a very big surgery. Your whole abdomen has been cut, lower abdominal area. There are 7 years which are cut down. And obviously, the recovery period in cesarean section is a lot longer than a normal vaginal delivery. And that is the truth. A normal vaginal delivery has its own set of problems or issues, that it's difficult for them to sit, it's difficult for them to defecate, it's difficult for them to move about, but it is a lot more harder for a cesarean section mom. And please don't just shame a cesarean section mother that they have opted a easy path. No, it's not an easier path for them. Yes, they have avoided that laborious duration of pain while giving childbirth, but they are suffering afterwards also. So both of them have their own struggles, and let's not shame our new mothers. We should be only supporting them. So these are the common changes: postpartum bleeding, night sweats, vaginal healing, mood swings. I think most of you will agree with that. The amount of mood swings which we have in our pregnancy is nothing as compared to what we get postpartum, right? I got it. Then next, the body pain. Let's just let's just address about the elephant in the room, postpartum body pain. Let me just tell you why we get and what to do about it. The lower back pain. The most important is lower back pain. I think even Lower back pain is the pain which every new mother gets, every new mother, whether they have undergone normal vaginal delivery or they have undergone cesarean section. And why is it so? Because after delivery, no matter how you have given birth, you are going to breastfeed your child. And the very important thing which most of the gynecists ask their mothers to do, always sit and breastfeed. Never do it in sideline. That's what most of the gynecists say. And this is the only reason prolonged hours of sitting that mothers get lower back pain. And why? Because they have weaker core abdominal muscles, they have weaker spinal muscles, and because of both these combined things or both combined reasons, our mothers get lower back pain because they were not aware of antenatal exercises, because they were not being made uh, to strengthen their muscles in their pregnancy. Most of the people now just say, "Oh, you're pregnant. Try to take as much rest as you want. Oh, you're pregnant. Now you have to eat for two people." And that's the reason for so much of weight gain during pregnancy and weakening of muscles and lower back pain. Now raise your hands, all of those who have this pain, lower back pain. Tell me what you can do. Yes. Okay. So what you can do, because you have to focus on your posture. You have to focus on your posture while breastfeeding. You have to focus on your posture while doing your daily activities. And you have to use proper body mechanics when you lift your baby or when you lift any of the uh, days. The second most common pain which women get is neck and shoulder pain. Again, the reason is holding and breastfeeding for extended duration of time. So what can be done to combat this? You can use supportive chairs and pillows while breastfeeding, which we always tell our mothers in our lactation counseling, what is the correct position for their breastfeeding. Then there are certain exercises which can be used to provide relief. They are neck stretches and then the neck strengthening exercises. Then the perineal pain, again, why it is so? Earlier I have told because of the episiotomy during childbirth and how you can help in alleviating that. You can use a six path. Six path is nothing but there is a tub which is being filled with warm water and then you have to simply sit inside while undressed from your base down. Okay, so if you sit in the warm water for 5 to 10 minutes twice a day, it is going to soothe your pelvic floor muscle and it is going to help in the faster recovery of your episiotomy. And the second precaution which you have to take is you have to simply avoid sitting for extended periods. Okay. Then the pelvic pain, there's a lot of pain in the hip region and the back of the thigh and the lower back area and front of the pelvis. This is why? Because during childbirth, there's a hormone called relaxin, which is which function is to release your joints, and this releasing of your joints helps in your baby moving down out through the pelvic outlet. So because of this hormone, there's so much of laxity in all of the joints, throughout the joints in your body, and that is why there's a lot of pain in each and every joint of your body. So what you can do, you can practice some pelvic floor exercises which are specific to pelvic floor, which is also being called as Kegels. But how to do and how to isolate that muscle, that knowledge is very important. Because whenever I ask any woman, not just a new mother, any woman to just try to contract their pelvic floor, what they do is they only and only squeeze their bum or they just squeeze their thighs, which is not the right way to do it. That's why you need to consult a physical therapist or a pelvic floor physiotherapist or a women's health physiotherapist to teach you how to isolate those exercises, those muscles. The joint pain, I have already told. So only low intensity exercises should be done. Now, the pelvic floor muscles is very important because this is the only part of our body which has been ignored for ages. So many women, if you ask your mothers, your mother-in-laws, any of your older relatives, what they have this urinary leakage while sneezing, while coughing, or while they just lift any load, or while they are laughing so hard that they leak. And it is so much common in elderly females. Why? Because their body has undergone through so many pregnancies. See how many brothers, sisters, siblings do we have, and how many siblings does our parents have? So many, five, six. It was very common in earlier times, and that's why a woman's body undergoes so much of pregnancy and childbirth. Their pelvic floor is so much stress, then they even get uterine prolapse, which is your uterus coming out of the vagina, the feeling of something going out, coming out, or the heaviness in the vaginal area. That is the prolapse, which is very common. And why is it so? Because of the weakness of pelvic floor muscles. So how you can do strengthening for those pelvic floor muscles? By Kegels. So this slide already I have told you, the recovery and rehabilitation. Can you please, anyone tell me, or just type or just raise your hand if you're that you know someone who has this urinary incontinence, the urinary leakage that they get? Please raise your hand. Mudita, so my voice was not clear. Is it okay now? Yeah, thank you for the hands up. Okay. Now coming on to the postural tips. What is the correct way to breastfeed? The correct feeding position is always you have to bring the baby to your breast. This we have always guided our mothers in our lactation counseling also. You have to use pillows to support your back. Your body should be erect in sitting position, and you should always bring your baby to the breast, and you should not just bring breast to the baby. And the proper lifting techniques is also sometimes discussed, that you have to always squat and lift anything. You should not simply stoop down. There should be enough chair support and cushion support for you. And there should not be a longer feeding duration. You should not just continuously sit for 20, 30 minutes, 1 hour. You should also always keep looking for active feeding. So if the baby is not feeding, but they just unlatch and take a break, you can simply lie down, or you can move about. So you have to take short breaks from prolonged sitting, and keep your body moving. That is how you prevent stiffness and you prevent pain. Now, postpartum exercises. Why I'm pushing so much about postpartum exercises? Why is it important? Because it not only improves your physical level, but it also boosts your emotional health. It helps you in overcoming that postpartum depression. It helps in clearing your mind. It gives some clarity. It enhances your mood. It reduces your stress, because what happens when you do exercise? When your body is moving, your body then signals the brain, and the brain, what it does, it just releases a hormone called oxytocin. This oxytocin is a happy hormone. It also releases serotonin. Serotonin is also a happy hormone. And how these happy hormones work? They help in reducing your stress. They help in uplifting your mood, which is important for a new mother. Because what is this stress is going to cause? The stress is going to negatively affect your milk supply. If your milk supply is going down, again this vicious cycle. If the milk is going down, then you get stressed. Oh no, my baby is going hungry. I have to add formula. Then again, stress is increasing, and then this stress is again negatively putting your milk supply down. So it is a vicious cycle, and we need to break this cycle. How you can break this cycle? You can improve the happy hormones in your body. And how you can improve your happy hormones? By including some movements in your life, by doing some exercises. And it helps in improving your sleep also, the quality of sleep. Every 2 hours you have to get up in the night to feed your baby. So how it is going to help you, because sleep is so much important for your body's recovery. If you're not sleeping well, even if those 2 hours you're not so much getting deep sleep, then how your body is going to recover? No, your body will not recover, and then you'll continue having those pains. The increased energy levels. So how it will help? It will help in reducing the feelings of fatigue, which is associated with depression. The social interaction, if you just participate in any group exercises or class, obviously you get same level people, same age group, or mothers, same new mother's trope. So it helps in, chit chatting and everything. It gives an important thing. It gives a routine and structure, because yes, you're thinking that I want to do something good. I want to take care of myself, but you are unable to do anything because every time you are just taking care of the baby or the house chores. So if you have some certain routine and structure in your day-to-day routine, then only it will help you. Disciplined life is important, right? Then the body image and self-esteem. Tell me, how many of you are happy with your body right now? Tell me, does that mommy pooch bother you? Does those enlarged breasts, leaking nipples bother you? And please stay honest. I don't think anyone here would say no, it's everything is okay. Okay. So how does this exercise help? It helps in improving your body image. It helps in giving you that confidence. And if you're exercising outdoor, if you're going out for a walk, then the fresh air also helps in clearing up your mood. Sometimes it's good that you are taking care of yourself instead of keeping everybody at priority level. You are keeping yourself as your priority number one. Okay. So it's crucial to understand that exercise alone may not be a sole solution for postpartum depression, but it should be a part of a comprehensive approach that may include therapy, medication, and a strong support system. By a strong support system, I mean the family, caregivers, the husband. So always try to talk and keep your feelings known to everyone. There's घुट के जीने में कुछ नहीं रखा है. So please share करो. We are here at Maa-Si Care, always there for you. You can talk to us, you can talk to your family, you can talk to your friends, and also exercise. So next slide. So the exercises, when to start, how to start. First, you have to get medical clearance. After 6 weeks, usually your gynec would give you clearance to continue for exercises. And first is you have to always start gradually, hydration. You have to focus importantly on core strengthening, because core is the most important muscle which is going to support your spine. And most importantly, you have to address diastasis recti. Now, what is a diastasis recti? See, these are all the images, these are all the tummies which look like diastasis recti. Does any of you connect to this? Do you feel your tummy right now looks like this? So it might be diastasis recti. What is diastasis recti? It is the separation of your abdominal muscles. And how it happens? It happens to accommodate the growing baby. So after delivery, it should resolve on its own in few weeks. But if it is still not resolved, then why it is important to look for it? Because the gap in both the abdominal muscle will be a weaker point from where hernia can happen. And the rehabilitation or exercises for diastasis recti are different than what a general cesarean section recovery or normal vaginal delivery the exercises are. So this is important thing. Please take a good look at those pictures. And if you feel that you have diastasis recti, then please connect with me. I can help you with that, because I am specialist in correcting this diastasis recti. And trust me, you need to get this corrected, because if not, then your mommy pooch is never going to go. You won't get your pre-pregnancy shape back. So how you can do your exercises? You must include your baby. There are certain exercises which I ask my new mothers to do, which include baby, and these are called as mom and bub class, in which we use baby as a prop so that the mother can look after their baby also and do exercise also. Then the exercise session should be short and frequent, because obviously the fatigue is there, the stamina level is down, and the baby also needs a lot of attention every 1-2 hours. So the sessions should be short and frequent. And you must also involve your partner to look after your baby. And there are certain couple exercises also in which husband can help support their wife in doing exercises. The introduction of safe abdominal exercises should be done for cesarean as well as normal vaginal. Why? Because there are chances of diastasis recti. Diastasis recti is important. I'm again emphasizing on this point. If you have diastasis recti, then you must get it checked by your gynecologist and your physiotherapist. The form should be correct and there should not be any high impact exercises. You can go to any physiotherapist, but only a women's health physiotherapist is going to guide you better on this, because we are trained to perform the specific exercises which are low impact and which are breastfeeding friendly exercises, which you should do, not the high intensity exercises which usually the gym trainers ask you to do to lose weight. Those are not the right way. These are only going to cause you hernia. So what are the guidelines? You should also always feed before exercising. You should wear a supportive bra. You should choose comfortable clothing. You should time up your workouts. Consider breastfeeding friendly exercises, because if you do high impact exercises, then what it causes? It is going to cause jerk to your breast and so much of discomfort and pain. Sore nipples can also happen. Then you must prioritize your self-care, create a flexible schedule, and you must join a postpartum fitness classes. But everything else, be patient and listen to your body, whether your body is ready for it. Okay. Now, the most important thing, weight loss during breastfeeding. How many of you think that you are losing weight while doing breastfeeding? We hear this thing, right? The breastfeeding helps in losing weight. So how many of you feel that, yes, you are losing weight simply by doing breastfeeding? Or is it the different way, other way around, that you are gaining weight while breastfeeding? Tell me. Start typing. Do you feel that you are losing weight?
Most of the times I hear mothers say that I am gaining weight during breastfeeding. Why there
Yes,
should be
yes, that happens. I have seen so many people. In fact, 90% of the women, they are gaining weight and not losing weight. Why? Because they are not aware of the right way to lose weight while breastfeeding. This is true that breastfeeding causes weight loss. Yes, breastfeeding is calorie expansion, but people are not doing it correctly. People are not taking their nutrition seriously. People are not taking their activity level or their exercises level seriously. So how to do weight loss during breastfeeding? Because you want to lose weight. Yes, nobody wants to be like so much of weight. So there should be gradual and sustainable weight loss, and you must prioritize nutrient-rich foods, because yes, you have to be calorie deficit diet for weight loss, but you cannot be in too much of calorie deficit, because you have to provide additional calories for your sperm producing the milk that your baby needs. If you just cut it out all the calories, then you won't get anything to make your milk. Okay, so you must prioritize nutrient-rich food. That's why we always give you supplements in our lactation counseling. That's why we ask you to have those superfoods, those Ayurvedic medicines. Why they are being prescribed to you? The only reason is they are going to nourish your body. Then you have to stay hydrated, drink 3 liters of water. That's what we ask you. Listen to hunger and fullness cues. Then breastfeed on demand. Always breastfeed on demand. This is the most important thing which we ask you to do. Incorporate all the exercises gradually. Consider your calorie needs. Be patient. And there are postpartum nutrition support is also there. We at Maa-Si Care, we are also planning to come up with this postpartum nutrition support specifically for weight loss. And it is in pipeline, and just all of you, those who are interested, please keep typing in the chat box and we will take care of it. Then you must focus on self-care. So how many times I'm just telling you that please focus on self-care. If you are not going to prioritize about your self-care, you won't be happy and you won't be able to feed your child correctly. And obviously, a happy mother is a happy family. So are you experiencing any discomfort or pain after childbirth? We are there for you. Okay? We are there in this journey of yours. We understand what struggles you are facing, because all of us at Maa-Si Care, we have also gone through this. We are also all mothers, and we have taken care of our child, and we are taking care of ourselves also. So we are here to guide you how to take care. Please take a look at those images. Can you relate with any of the image? A mother depressed with the crying baby who is hungry, baby who needs to be fed formula, or the mother who is having sleepless nights, who is having so much of back pain, so much of neck pain for continuous sitting. Those who are having problem in getting up from the floor, they are having crackling knees, they are having pain in their knees and hips. How many of you correlate with this? Do you feel that, yes, I'm going through this? Don't you think? Yes. Do you want this thing to begin? Do you want to move from that slide to this slide? Be happy with a happy child. Stay active with your baby. Do you want to keep running after your baby? Do you want to be full on, hands on mother? Do you want to play with your child? Do you want to feed your child? Do you want to go outside with your child without any pain? Do you want to stay active with this? Then you have to. You must prioritize your self care. All right. So how to get rid of this mommy food and how to go to this active phase of your life. Do you want to stay active with your baby like this? These new mothers? Yes, of course, why not? So we are here for you. We are offering you this postpartum wellness program. And I'm Dr. Akanksha Dixit. I'm a women's health physiotherapist, and I have been at this point in my life also where I have given birth to my baby, and I was also lost in sleepless nights, and I was also not doing any workout. But then after few weeks, I came back to my senses, and then I applied all my knowledge on myself, and then I transformed myself from a depressed mother to a happy active mother who has gone back to her career. And that is why I have this experience, and I have also trained my other mothers in transforming themselves. And now we have teamed up with Dr. Tanima to introduce this postpartum wellness program to you, and why you should enroll for it, because we are going to give you a personalized care. Those physiotherapists out there who are orthopedic physiotherapists, neurophysiotherapists, they are not going to guide you better on this. I will be able to guide you better on this because I have been trained to handle postpartum recovery period. Okay. So these are tailored treatment plans according to you, whether you have undergone cesarean section or whether you have undergone normal vaginal delivery. I am experienced. I have 10 years plus experience in physiotherapy, and I have been a consultant physiotherapist here in Lucknow for more than 10 years. And I have also been an assistant professor in Bhopal, so I have teaching academic experience also. So we have a holistic approach, as I have told you earlier also, that we are planning to come up with postpartum nutrition support also for weight loss for new mothers. So it is going to be a holistic approach where we are going to provide you with emotional counseling also if needed be, and the sessions are going to be convenient. You must type in the chat box that whether you want it in morning or in evening. Let's have a poll about it. And these are few of the offline sessions of mine where I'm training my mothers, my new mothers, and my antenatal classes also. You can see how much my mothers are active, right? Aren't they happy? Aren't they laughing? Not about smiley, but in the above slides you can see. So this is also one of the offline sessions, group exercises. So it is a happy time, whenever you join a same category of group, same all our new mothers. It's happy to quickly exchange your views with them. And this is me, 9 months pregnant and 8 months postpartum. Do you also want this transformation? If yes, then you must join our program, right? So ours is a 6-week program. The first batch, we are starting from 4th March, which is the Monday. Classes will come on Monday to Friday. It will be a live Zoom call where I will connect with you all daily. These are going to be basic low intensity exercises, which are breastfeeding friendly, low impact, 30-minute duration, because obviously a new mother cannot do more than that. 9 a.m. to 9:30 a.m. is the proposed timing. You can always take suggestions from you, whether you're comfortable with morning time or evening time. And if you're unable to join, then recording will be provided. It will be accessible to you during the whole course. The offer, it is currently at 2,999 for 6 weeks program. If you are interested, then come. This is the offer that we are going with. And because it's a Women's Day week, so there's Women's Day offer also. You can get it in 25.99. So I would conclude by saying invest in your health because you deserve it. There's no need of unnecessary going through pain, back pain, low back pain, pelvic pain, joint pain. There's no need to remain depressed. When you are having a chance of staying happy, staying healthy at your own disposal, then why not? Why not join this? So as I have told earlier also, we are with you in this journey of motherhood. Just tell us when we can start. Okay, Dr. Tanima? I think we are now open for question and answer round.
Yes. So any questions, please write in your Q&A box and Dr. Akansha will take the questions. And right now, because we are running an offer for next questions, so till the question answers are there, we are giving an option of just 2,199. That's all. For a 6 weeks program, daily, Monday to Friday, Dr. Akansha will be taking a half an hour session with you all. She will be guiding you on about your postpartum wellness, about the exercises and everything. She'll be there and hand holding you, and all things she has shared already. And for this session right now, when she's taking question answers, she's offering her program for 2,199 only. This is too less for in compared to your health. And I'm sharing the payment link in the Q&A box, in the chat box, and you can make the payments and block this, because we'll be taking only few mothers in this, because to give attention to everyone becomes difficult if it is a bigger batch. So I'm just posting it there. And till then, you can start taking questions, Dr. Akansha, and we'll see that.
Okay, Dr. Tanima, thank you.
So I've shared the link there. Join in there, and we'll reach out to you tomorrow morning once your payments are confirmed, and we'll start the batch from 4th March. And this is just 2,199 for today, right now, till Dr. Akansha is taking question answers. Take care, everyone.
Okay. Okay, there's a question from Bhumika. I have back pain from the childbirth. My baby is 4 months now. Do you want to ask anything else, Bhumika? Because I think you have stated that you have back pain from childbirth. Yes, that's very common. And there may be multiple reasons to it, whether you had it earlier in pregnancy also or before pregnancy, or if it has started since you have started breastfeeding with your child in second position. Do you want to elaborate on that, Bhumika? Mudita, Dr.
Manisha. Manisha,
Manisha.
if you want to talk to Dr. Akansha, you can just raise your hand. I'll allow you to talk. I've allowed you to talk, Manisha. If you want to talk to Dr. Akansha to discuss your issue, you can just unmute yourself and talk.
Hi, ma'am.
Hello, Manisha.
Yeah, actually, I have this back pain issue. Like, it is on and off. Like, it is not regular. but sometimes I used to get, and it post delivery, like it is very like painful and all.
So, so are you doing anything for that?
No, I haven't started anything.
Yes, you didn't only got time for that, right?
Yeah.
That is why we are emphasizing why self-care is important. Where do you see yourself after few months? Do you think that you'll be able to keep tolerating the pain for more months? No, na?
No.
No. So you
Yeah.
want to get rid of it. That's why we are coming up with this program so that none of our mothers should be able to should have to undergo this much pain. What you can do is start doing hot fermentation, and there are certain exercises that you can connect me with, and I will teach you how to do. Okay,
Okay.
Manisha?
Yeah, sure.
That is the helpline to you.
Next, Bhumika also wants to ask question. Bhumika, if you want to ask question, I'm just allowing you to talk. Bhumika, do you want to talk? Yeah.
हाय डॉक्टर आकांक्षा
Hi.
एक्चुअली मेरे बर्थ चाइल्ड का हुआ था उसके बाद से मुझे उस टाइम पे कुछ भी प्रॉब्लम नहीं आया था बॉडी में मतलब आई डोंट फील एनी काइंड ऑफ अ पेन नथिंग बट अभी लास्ट 1 मंथ से मुझे सीवियर बैक पेन है मतलब एवरी 2 to 3 days में मुझे पेन किलर्स लेने पड़ रहे हैं मतलब उतना सीवियर बैक पेन स्टार्ट हुआ है मतलब अभी जो मेरा चाइल्ड बर्थ है मतलब वो 4 मंथ का हुआ है पहले इनिशियल 3 महीने में मुझे कोई भी प्रॉब्लम नहीं हुई बट अभी अचानक से मुझे ये हुआ है मतलब मैं मेरे बेबी को उठा भी नहीं सकती मुझे इतना बैक पेन होता है
करेक्ट। आपको क्या लगता है पिछले 1 महीने में क्या चेंजेस हुए हैं? बेबी ग्रो किया है, बेबी का वेट बढ़ा है, बेबी की एक्टिविटीज बढ़ी हैं,
नहीं
बेबी
एक्चुअली
बढ़ गए?
हाँ पहले जो टाइम था ना उस टाइम पे मैंने काफी मतलब आराम किया है अभी मैंने थोड़ा थोड़ा काम करना चालू किया है थोड़ा थोड़ा मेरा एक्टिविटी चालू किया है सो मुझे लग रहा है उसकी वजह से हो सकता है बिकॉज मेरे अचानक से ही सारे वर्क करना चालू कर दिए हैं मतलब अभी मैंने 2 व्हीलर भी ड्राइव करना चालू किया है फिर घर पे भी जो छोटे मोटे काम होते हैं वो करने चालू किए हैं तो आई फील कि उसकी वजह से ट्रिगर हो सकता है बट ये बहुत ज्यादा है मतलब नॉर्मल से ज्यादा है
ठीक है। आपका सिजेरियन हुआ, नॉर्मल वेजाइनल डिलीवरी था?
सिजेरियन है सिजेरियन
सिजेरियन हुआ था। आपने कुछ एंटीनेटल एक्सरसाइजेस किए थे?
सॉरी
आपने कुछ एंटीनेटल एक्सरसाइजेस किए थे?
नहीं उस टाइम पे बिल्कुल भी कुछ भी नहीं किया था
तो वही जो मैंने आपको रीजंस बताए हैं मैम, भूमिका, वही चीज है कि आपकी जब भी सिजेरियन होता है ना तो कट सिर्फ आगे ही लगता है, लेकिन उसका असर पीछे बैक मसल्स पे भी आता है। ठीक है, एंड इट हैज नथिंग टू डू विद द एपिड्यूरल और स्पाइनल एनेस्थीसिया व्हिच दे गिव यू। नो, इट हैज नथिंग।
राइट
यूजुअली लोग यही बोलते हैं इंजेक्शन लगा था उसके बाद से ही दर्द होने लगा। ना भैया, ऐसा कुछ नहीं होता है। ये जो पेट आगे बाहर निकलता है ना, इसी की वजह से स्पाइन पे लोड आता है। स्पाइन पे लोड आता है, मसल्स वीक रहती हैं, और फिर जब हमारी बॉडी इतनी वीक है और उसके बाद हम बिना उसको स्ट्रेंथन किए वापस से अपनी नॉर्मल डे टू डे एक्टिविटीज की तरफ जाते हैं, तो अगर एक कमजोर कपड़ा होगा, अगर उसके ऊपर लोड डालोगे तो क्या होगा? फटेगा ना।
राइट
मसल्स भी वही है, मसल्स भी क्या है, फाइब्रस टिश्यूज है साथ में उनकी लेयर्स। आप जब जितना ज्यादा उनको ओवर स्ट्रेच करोगे और फिर सोचोगे कि वो वापस से काम पे लग जाए तो पेन तो करेंगी। पेन इज द फर्स्ट सिग्नल which your body sends to you that there is something wrong, there's something going wrong. Pain is always protective in nature. It is going to help you in prevention of your injury. So if you are not listening up to your body pain, if you are not doing anything correctly for that, then it is also very cost you, right?
ओके
So you must get yourself checked with a physiotherapist, and there are certain exercises which are definitely going to help you.
ओके
Trust me, they are going to help you without any surgery, without any medication.
ओके ओके
Are you? Is my explanation okay to you, Bhumika?
यस
Okay. Take care, Bhumika.
थैंक यू
So there is a question from. I have loose tummy. I still look like 6 months pregnant. Yes. That's what I have shown you the images, right? Diastasis recti. It may be possible that you have diastasis recti, Seema. You must get it checked. There's a simple self-test exam also for it. It's available on YouTube. Try to do it by yourself, or if you're not confident enough, then just go to a physiotherapist or a gynecologist. They will guide you better. Or you can also, or for online. I can help you in dealing with that. So this diastasis recti, this is so much common in our females, and most of them are not aware about it. They just keep going about like, oh, ये तो बच्चा पैदा किया है, तो इसलिए पेट अब ऐसे ही हो जाएगा. बट ऐसा नहीं होता, पेट ऐसा ही नहीं होता, मेरा नहीं है ऐसा ही. और बहुत सारी ऐसी मेरी जिनका नहीं है. हम सबने बच्चे पैदा किए. तो थोड़ा सा अवेयरनेस लाना जरूरी है. इसमें 2 फिंगर्स गैप भी हो सकता है, 6 फिंगर्स गैप भी हो सकता है. एंड मैंने 8 फिंगर्स गैप, 8 फिंगर्स, दिस इज 4 फिंगर्स एंड 4 फिंगर्स, 8 फिंगर्स, इतना गैप भी होता है लोगों का एब्डोमेन का, और उसको भी हमने रिड्यूस करके 2 फिंगर्स गैप तक लेके आए हैं विद इन 3 months. So it is very much suitable, and you must get it checked. Then there is a question: sacroiliac joint pain, lower back pain after C-section. This answer is same to you. The lower back pain after C-section, whatever I have explained to Bhumika. Sacroiliac joint pain. Okay, sacroiliac joint. For others who are not aware about this, sacroiliac joint is the joint which is there in between your spinal column and your hip bones where they meet. So that is called as your sacroiliac joint. It is right at the lower back, and most of the people who have lower back pain, who have a lot of, who have huge tummy, they have a lot of central fat. It causes a lot of stress on the SI joint, and these joints get inflamed. So the sudden sharp pinching pain which you get whenever you try to turn your body, करवट ले रहे हैं रात को, अटक गया, चमक गया, खिटक गया, ये सब यूजुअली बताते हैं पेशेंट या न्यू मदर्स. So that is a sign of sacroiliitis. ऐसा एक्सरे कराओगे तो कुछ नहीं निकलेगा, बट सब्जेक्टिवली या ऑब्जेक्टिवली आप जब वहां पे पैल्पेट करेंगे तो टेंडर होगा, वो काफी टेंडर मतलब दबा के बहुत दर्द होता है उस जगह पे. Having diastasis recti and umbilical hernia, can you help me with online exercises, Divya? Yes, Divya, I can surely help you. Most welcome, dear. It's good that you have observed this and you are ready to take care for your body. Please connect with me, please. Most welcome. Back and neck pain, Supriya. Yes, Supriya, I have already told what are the reasons for back and neck pain, and using strengthening as well as stretching exercises. You can connect with me and I will guide you further. Anything else anyone wants to ask?
I think that's all. I think the questions are answered. If anybody has, we are giving the last call that if anybody has any questions, they can raise their hand. I'll unmute you. And if you don't, then we can move ahead. Okay, so I don't see any new questions there. Okay, so we can wind up the session now. So I hope the session was helpful for you, so that you came to know that what all things are happening to in your body, and it is treatable. If you're having back pains, if you're having any kind of issue, specifically this diastasis recti is a very notorious thing, which is very common with many mothers, and they don't know about that it is a diastasis recti, and it causes a lot of issues. And especially when you're handling your baby, it becomes very difficult to have the things in a proper format. Right, Dr. Akansha? You would have seen a lot of patients who are having these kind of issues.
Yes,
So,
it's very common.
and recently I am also listening from mothers, they have this urinary incontinence also. So what do you say about, because we used to think previously that this is common for the mothers who undergo normal deliveries. But when these days cesarean sections are more common, then still they are having urinary incontinence. What is your say about that?
Yes, because even though they have opted cesarean section for their childbirth, yet their pelvic floor has undergone the whole 9 months of pregnancy. The pelvic floor has already suffered during pregnancy, and that is why even cesarean section mothers get urinary incontinence, because they are not aware about. Usually, see, whenever you see people in the gym also, they are working on their biceps, they're working on their triceps, and women are obsessed about getting flat tummy. But nobody thinks or work on their pelvic floor. Even males have urinary incontinence. I have seen males having urinary incontinence. I have few of my clients, males, who are urinary incontinent. So it has nothing to do with whether you have undergone cesarean section or normal vaginal delivery. If you're not working your pelvic floor out, they are going to give you this urinary incontinence. And you must be aware about how to isolate those muscles and not just squeeze your buttocks or just tighten your thighs. It is not going to help you. You must be able to isolate your muscles.
And one common question which is asked by most of the mothers is that if I do any exercise, will it affect my breastfeeding? Will it affect my breast milk supply? This is a very common question asked by mothers that I want to exercise, but I feel like my breast milk will go down. So what is your say about that?
Yes, that's why I have mentioned that you need to do breastfeeding friendly exercises. That's why you need to connect with a women's health physiotherapist, one who is aware about. That is true. There are certain exercises which impact your milk supply, but not in the way that directly, but because there are the high intensity exercises or high impact exercises are going to cause breast discomfort to you, which ultimately causes sore nipples, and then obviously, if you're having sore nipples, that you're going to feed less, and if you're feeding less, then your milk supply is going to go down. So indirectly it causes, but not the correct exercises.
And one thing that many of them feel that because of breastfeeding, because of the wrong posture, because of most of the times when I see mothers who are breastfeeding, they are going down, like they're moving forward, and that causes. I can see your son. Hey, Arav, we want to join the session.
Yes, Anav is there.
So, Arav is very excited that he wants to join the session. Okay.
Yes.
So most of the times they are just moving forward when they are handling the baby, and many times when we improve their latching, we just tell them, hold the baby up, don't go out forward. So suppose
Yes.
somebody who has got this issue and is suffering with the chronic back pain and neck pain, how is it resolvable by exercises and with a routine which the mother is going through everything?
Oh, they are very easy exercises which can be done, and they only require 10 minutes of your daily time. And you only need a bed for that. That's it. Even in fact, there are certain exercises which you can do while you're working in your kitchen. You can simply do back bend stretch. You can simply
Wait.
do
So I'll do one thing. So how many of you are having back pain and neck pain? Just raise your hand and let me know how many of you are having this back pain and neck pain. Just raise your hand. Seema is having. Who else? All our fit girls here. Dr. Akasha, I think we've got wrong participants today. See, only Seema is there who is having back pain or neck pain. Otherwise, all are fit and fine. All the girls. Okay, that's great. So, any one thing which we can feel instantly that, okay, it relieved over. I remember once I was having headache. So I told Dr. Akansha that I'm having headache. And she just told me one thing, that she asked me to keep her hand here and just have extension, and it immediately made my headache go away. I really remember that day, Dr. Akansha. So now just tell me one tip right now which will help in relieving that kind of muscle pull which is there in all of our back and neck specifically.
Yes. What you can do is, I think all of you can open your camera so that I can also see that you people are doing
Actually,
it
this is a
correctly or not.
webinar model, so I don't think they have an option of there, because I
Oh,
don't
okay.
know how to change it into a meeting format. I'm not that good with the tech things.
Okay,
So
okay,
this
okay.
is
It's okay,
done by the
Dr. Purnima.
marketers. So, but they can raise their hand, they can see the things,
Let me
whatever
just
is
see
there.
that all of you are interested, whether you want to do perform those stretches with me. At least now raise
Yes,
hand.
let us ask that. How many
Don't
of
have
you want
any,
to
you
see
don't
some
want any.
stretches right now and perform them live right now? Raise your hand, otherwise we are not going to do it. See, this is a very unresponsive people. No, Dr. Akash, I don't think they all need it. They are all happy with their bodies and they are having no issues. So leave it, Dr. Akansha. It's okay. They don't want it. Nobody's raising hand. It's okay. So that's all. We should end the session. I think they are not having any issues. Everybody's happy and they don't have any kind of issues. Okay, so thank you so much, Dr. Akansha, for joining us and sharing this insightful session. Let's see more and more. And 3 of them have recently joined. I just checked right now. So we'll just have them in the batch from 4th March. So more will join because they'll keep thinking that should I do it, should I not? So right now 3 have joined. So they have availed that 21.99 offer. And I'm thinking of extending it till 12 midnight. So all of you can think about it and can join till 12 midnight. And then from tomorrow, we will have our regular sessions. Okay.
Okay.
Okay, so
Thank you so much, Dr.
okay, take
Kanika,
care.
for having me.
Bye-bye. Have a
Bye-bye.
good night. Bye.
All the